When you try your best but you don't succeed. When you get what you want but not what you need. When you feel so tired but you can't sleep. Stuck in rivers. And the tears come streaming down your face. When you lose something you can't replace. When you love someone but it goes to...
So the idea of this CANET study is to try and understand why patients with atrial fibrillation attend the emergency department. This is a very, very important question that's never previously been answered. And we're going to use this data to try and develop strategies to reduce further hospitalizations in the future.
Hi, my name is Brigitte Zeil, and I'm the project manager for the AFED study in Kingston, Ontario. We have approximately 10 sites participating across Canada, and we have a great distribution of hospitals in that we have academic centres and community hospitals. We will enroll approximately 800 patients in total, and I think this study is very relevant because we're looking at the reasons why patients with a history of atrial fibrillation present to the emergency room for treatment. And we're hoping that we can explore alternative strategies for these patients and not inundate the ED departments.
So the early findings seem to indicate that the main reason people come to the emergency department is because they really are concerned that they're going to die. It's not because they're, experiencing a little bit of a flutter and they're wondering whether they should go or they shouldn't go. Most of the people who are actually going to the emergency department are in fact quite frightened for their lives.
From our pilot study conducted in Kingston, we found that patients received conflicting advice from both their family physician and their cardiologist. These are results we hope to explore in our national multi-centered study.
It's a first in Canada.
And I said, that's great, as long as they can fix me up.
The hybrid cardiac ablation procedure treats the most common type of irregular heart rhythm. The key to its success is having work done on the inside and outside of the heart simultaneously.
It's a novel technique because it allows us to map the heart in many different ways, and it allows us to deliver energy, which is called radiofrequency energy, to treat arrhythmias or short circuits within the heart.
It avoids the most common surgical incision, which is opening the breastbone, and that obviously impacts a lot the recovery and how fast a person...
Welcome back. Once again, Queen's University is making headlines with breakthroughs in research in medicine, and two people responsible for the latest breakthrough we're going to talk about is Gianluigi Bislieri and Benedict Glover. We thank you so much, Queen's doctors here and researchers. Breakthroughs in heart surgery.
Yeah.
Explain the process here and why this is getting so many headlines.
So basically, we're trying to treat a very common rhythm disturbance called atrial fibrillation. This affects about 350,000 people across Canada.
Wow.
So we've developed a procedure which combines what I normally do, which is where I put a catheter or a wire in through the groin all the way up into the heart, and what Gianluigi does, where basically we make little holes through the chest wall and we can access the heart from both the inside and the outside structure and target these short circuits and cauterize them or burn them away to treat the underlying rhythm disturbance.
And you've done this twice before already, and more are slated.
Yeah.
Yeah, we started in June, and we are continuing our program with at least some procedures per month, and obviously it's a growing program.
Wow.
And we're very excited about that because the combination of these two approaches have been developed only recently, and only a few centers in the world are especially combining both teams at the same time in the same operating room.
Less doctor's visits, less hospital visits, less medication is the good news from all of this.
Yeah, exactly. So this is designed to treat symptoms so we can eradicate palpitations, tiredness, shortness of breath, get rid of some of the medications.
Wow.
So this will have an impact on patients, and even it may, in the long term, we're looking into more details, it may reduce the risk of stroke.
Yeah, I was going to ask if you can apply what you have researched and have discovered into other areas as well.
Well, definitely the advantage is that what we can achieve with this procedure is really combining the best possible treatments from both sides, and we can provide a more effective ablation. This is a technical term to define when we burn on the heart to get rid of the irregular heart rhythm, and at the same time we can also remove a portion of the heart that is often responsible for strokes. It's called the left atrial appendage.
When you first heard about Queen's and the pitch maybe to come to Kingston and work with Queen's, what was it that you said yes because of?
The interesting thing about Queen's, particularly in the last few years, is they've recruited a lot of new physicians and surgeons from around the world. One of the beauties of it is that they've built up a lot of research, so we can combine our clinical work, and we're both clinicians, with really state-of-the-art research. And we've had a lot of support from senior Queen's and from Kingston Health Sciences members. So there is a huge drive here to make this one of the top cardiac centres in Canada, which is our overall aim, and that's why we're here.
And one of the best in the world as well.
Yeah.
Yeah, I mean, same for me. I was very much attracted about the potential to further expand, especially these very innovative areas of research. And I have to say, I was specifically interested by the presence of a group like Ben Glover, where they are extremely active in arrhythmia, and that was I was seeking in order to further expand this specific area of research.
Now, are other doctors, researchers coming in and observing?
We have doctors come in to train in some of the complex procedures that we're doing with some of our new mapping systems, and we also travel to other centres to train other doctors. So we're building up a reputation nationally and internationally to train other physicians and surgeons.
Yeah, and also from our standpoint in cardiac surgery, I am very happy to say we are developing a very active minimal invasive program. So this is an approach that in general, less invasive approaches are not very widespread in Canada in cardiac surgery, and we are developing a very active program from that standpoint, and we are currently having surgeons coming to visit us as well.
After the procedures, what are you hearing from the patients? They think, thank you, you saved my life, this is so much better, what a better quality of life?
Yeah, I mean, it takes time for the patients obviously to recover from the initial procedure, but the long-term results are good. The medium-term results are certainly very good. So we're getting very positive feedback. The patients where this procedure is successfully working are really very grateful, and we're going to continue to provide that service for as many patients as possible.
What is the recovery rate?
The recovery is actually very fast in terms, especially when you compare to like a standard surgical procedure.
Right.
We're not talking about staying in hospital for a week or, for example, taking weeks before they can return to normal daily activities. We're talking about going home after 2 days and basically being able almost immediately to return to their normal activities.
Excellent work, gentlemen. We thank you so much for coming in. Thank you for the great work you do. Once again, Queen's doctors are Gianluigi Bislieri and Benedict Glover.